Ever wondered about the framework that enables your arm to rotate, twist, and carry out a myriad of movements? It's the radius bone that plays a key role. Nestled parallel to the ulna, the second bone of the forearm, the radius is a long bone that pivots around the ulna, enabling movement at the proximal and distal radioulnar joints. This bone articulates at 4 distinct points, each contributing to the dynamic functionality of your arm. So, the next time you rotate your arm, remember there's a lot more to it than meets the eye. Let's delve into the first part of the radius, the proximal region. This region is a key player in the elbow and proximal radioulnar joints. Its structure is unique, boasting 3 important bony landmarks: the head, neck, and radial tuberosity. The head of the radius is a disc-shaped marvel with a concave articulating surface, thicker medially. This is where the magic happens in the proximal radioulnar joint. The neck, on the other hand, is a narrow strip of bone that lies between the radial head and radial tuberosity. It's like the middleman, ensuring smooth communication between the two. Then we have the radial tuberosity, a bony projection that serves as a home for the attachment of the biceps brachii muscle. It's like the anchor point, holding things together in a beautiful symphony of motion. The proximal region, thus, is the starting point of this fascinating bone, setting the stage for the rest of the structure. Moving along the arm, we find the shaft of the radius. This part of the radius bone is intriguing in its own right. As we journey from the proximal to the distal ends, we notice an expansion in the diameter of the radial shaft. This growth in size is not haphazard, but serves a specific function in the architecture of our forearm. Now let's talk about shape. Much like its companion, the ulna, the radial shaft is triangular in form. This geometric shape is defined by 3 distinct borders and 3 surfaces. Each of these structures play a crucial role in our forearm's mobility and strength. In the middle of the lateral surface, you'll find a small roughening. Now, this isn't a mistake of nature, but a deliberate design for the attachment of the pronator teres muscle. This muscle helps you rotate your forearm, like when you turn a doorknob. Isn't it amazing how every minute detail contributes to the functioning of our arm? Finally, we reach the distal region of the radius. This area is where the radial shaft expands to form a rectangular end. There's a projection on the lateral side known as the styloid process. This process sticks out distally, enhancing the radius's lateral reach. Now, if we navigate to the medial surface, we'll find a concavity called the ulnar notch. This notch is where the radius articulates with the head of the ulna, forming what we call the distal radioulnar joint. This joint is pivotal for forearm rotation. But the distal region doesn't stop there. It also has 2 facets on its surface that articulate with 2 of the carpal bones, the scaphoid and the lunate. This articulation constructs the wrist joint, allowing for a range of wrist movements. So the distal region of the radius isn't just an endpoint, it's a complex structure that facilitates vital movements and forms critical joints. The distal region, thus, completes the structure of the radius and plays a crucial role in the wrist joint. So, we've journeyed from the proximal to the distal region of the radius. We've explored its articulation points, from the elbow joint, through the proximal radioulnar joint, down to the wrist and distal radioulnar joints. We've appreciated its bony landmarks, the head, neck, and radial tuberosity. We've followed the radial shaft's expansion and admired the distal end's unique structure. And there you have it, a quick tour of your radius bone, a marvel of biological engineering that enables the incredible dexterity of your forearm.